So a lot of things go into having arm pain. Okay, what most people want to do is immediately blame their mechanics because I don't look like this professional thrower, I don't get into this position. My pitching coach said because I do this with my leg and with my arm, that's why I have arm pain. It's really not that easy. And with most of the people that I've worked with, it's most common that they have arm pain because they are weak. I know, right? But if you're weaker than a 12-year-old girl, why do you expect to be able to throw hard and safely and consistently without pain? That doesn't really make sense, does it? So this is where it pays to pay, okay? If you have somebody in your corner who can guide you in the throwing process, cover your mechanics, get you stronger, help you get healthy so that way you can sustain the demands of the throw, you're probably going to be in a much better position than somebody else watching this video right now who's never had a real throwing coach besides one-off pitching lessons, who's never hired a strength coach besides going to EOS with their friends. You're going to be in a much better position than them simply because you've paid to play. So to be very clear, this is not medical advice. This video is not made to fix you. This isn't going to diagnose everybody's individual arm pain issues, but it will help you get on the right track if you're doing other things correctly. Keep in mind, all the athletes that we've trained over 2,000 baseball players now, we've ran into people with arm pain, coming back from surgeries and lingering issues. And all of these people, though, are paying us to help guide them in their training process so we can constantly keep up with them and their needs throughout the season and into the off season. So with that disclaimer put forth, I like to use the 1 to 10 scale on pain. If your pain is up around a 5 or beyond and it's pretty consistent, I highly recommend you go get some imaging and then hire some professionals to help. But if not, and you're just dealing with some lingering small issues, this video could definitely help you as long as you implement some of these things based off the symptoms that you're having and use your brain and think, okay, like if I have arm pain, if I have bicep pain, if I have elbow pain, I'm gonna use these specific modalities in this video because we're gonna cover a lot. We're gonna target the shoulder, we're gonna target the bicep, we're gonna target the elbow. We're gonna do a bunch of different modalities in here and I'm gonna walk you through it and break down certain things so that way you can be like, I have this symptom, I'm gonna try to apply this. Don't use a shotgun approach and throw everything at the wall and hope that it works, okay? Try to pick and choose little things throughout this video that you can use. And if it doesn't work, wash it and pick and choose some other things, okay? With all the athletes that we've trained, we have some pretty good data points on it that a lot of this stuff does work. This is the stuff that we actually implement here to help our athletes feel better and hopefully mitigate some of their pain. So we're gonna start with some soft tissue stuff and then some internal rotation, external rotation, things that you can do to prep your shoulder to get ready to throw and prep the tissues around your elbow to get ready to throw. But after we go through that, I'm then gonna walk you through corrective exercises that you can do any day that you want. You can do before, after your training sessions, even before you're throwing, okay? But I'm gonna let you choose when, where, how to implement that. Again, like I said, not a shotgun approach. Pick and choose little things that you want to do and tamper with as you get going. So we're going to start with some soft tissue work. Now, there is no research saying that soft tissue work is the holy grail of taking away pain, but what it does do is it helps you relax. Okay, and if you can relax into certain positions, you may not have the pain that you currently have. So I know soft tissue work can be an unlock for a lot of people. So for those of you who are experiencing some pain around the anterior side of your shoulder, a big unlock for that is trying to soft tissue some of the pec here, some of the trap, and just some other tissues right around here very lightly before you get going. So what I like to start with is a baseball, easy to find. You don't have to use a racquetball, you can just use a baseball. Up on a wall, okay, go like this, and I wanna go with the tissue of my pec up and down like that, okay? And I won't do this for 10, 20 minutes. I'm only gonna do this for long enough until I feel like I can relax into that position a little bit and not have that sharp pain that I once had. Then I'll pick my arm up right in here, okay? And I'm just gonna slide my arm up as the ball's pressing right here into my pec. I'm just gonna slide my arm up this wall and try to keep the ball in its spot. Right now I feel a good stretch. Reach up, there you go. And once you feel like you can reach all the way up this wall, applying the same pressure into that ball without pain, and it feels like it's loosening up, you've done your job right there. You don't need to beat a dead horse and keep going, okay? After that, we'll take the ball, put it on our trap right here, get up on the wall. I know you guys seen this. We're just gonna roll our trap back and forth right in here. So after I'm done rolling that out, now I'm gonna do a doorway stretch here. So all I'm gonna do is put my arm up at a 45-degree angle like this, and I'm just gonna kind of lean into it just a little bit. And as I lean into it, I'm looking to stretch right here around the pec. I'm not ripping into the front side like this and creating any pinching in the front of my shoulder. If you have pinching there, you're going too far and doing too much, okay? So I like this 45-degree angle here, and I'm just gonna kind of lean and pull my pec this way just a little bit, because now I can relax in there. So I'm just gonna kind of come in and out. I don't wanna hold this static stretch for multiple minutes. I'm just gonna kind of come in and out, get a good stretch in my pec, on the back side of my shoulder as well. Feel good, and then call it a day from there. The next thing I want to take you guys through is pails and rails. So if I just did some soft tissue stuff, and now I feel like I can get into deeper ranges of motion than what I could at the beginning. So now it's time to add force to those tissues. Not significant amount of force, this isn't max effort. So let's think on a scale from 1 to 10, 10 being max effort, all in effort. I'm not trying to do that. I'm gonna stay under a 7 for these, okay? Because I'm just prepping myself to throw. But right now I'm gonna go through some internal rotations, okay? So on this, that's as far as I can go internally right now. Not that much. But if I press my hand up against my other hand like this, I'm not compensating at my wrist, I'm keeping it straight. If I press it up against my hand like that, and I hold that for about 5 to 8 seconds at about a 7 on my output, now when I lift this other hand up, I'm gonna be able to press down and go a little bit more. Look at that, not compensating at my wrist, not moving my elbow, just going a little bit more. And I'm pulling now, trying to take this meat down to the floor at about a 7. Now I'm gonna relax right here, just for a second, sit in this new range of motion. Then I'm gonna press up. So I'm adding force to this tissue. On the progressive side of the tissue, which pails and rails stands for progressive anticular isometric loading. So these are isometrics, okay? I know it's fancy, but don't worry about it. And then the regressive side of the tissue is the rails, okay? So now I'm gonna go on this side, and I'm gonna press down just a little bit more. Notice I got maybe 2 or 3 more degrees right there. I'm gonna keep pulling, keep pulling, keep pulling. Good, I'm only gonna do this one more time to get myself into the deepest end range that I can, and then call it a day on internal rotation right there. Okay, now press down, see if I can get some more, and I can't, so I'm just gonna keep pulling anyways, because the act of me doing that is still sending force to the tissues, which is a good thing, okay? And then I'm gonna relax in this new range of motion right there. A lot of twitching, a lot of shaking, because I'm in a new range, completely fine. And also, I don't have any pain in my shoulder right now doing this. Okay, so I'm not just sleeper stretching and hammering my arm down into a deep range of motion for no reason. I am progressively loading those tissues. So now I'm gonna take you through some external rotation pails rails, okay? Same sets of reps that we just did on internal rotation and the same concept, but now I'm gonna do this standing up. You wanna make sure when you're doing this that you don't get up here at a 45 or underneath. You're gonna be right at about that 90-degree angle with that humeral head and good congruency with the socket, okay? So this is the humeral head right here, and I just want it to sit right in the middle of that socket when I start. Now my pails is gonna be me pressing into this rack, okay? And I'm gonna press into that at the same intensity, about a 7, another 5 to 8 seconds. And then when I lift off, I'm not going to compensate at my rib cage and lumbar and expand like this so I can get more. No, I'm only gonna go into what I have, okay? So that's gonna be about this for me right now. And as I get going through this, I may cramp on the backside, that's fine. Try to fight the cramp, but don't go through severe pain. And then I'm just gonna kind of work my way through that a little bit lightly, because it's not a training session. I'm just trying to send force to those tissues to get my shoulder prepped and ready to go. So if I'm having a little bit of bicep pain or some forearm pain, then I'll probably start my soft tissue off there. So I can use anything for this, by the way. I know you guys have seen rollers like this before. It doesn't matter what roller you use. But all I'm gonna do is glide this up and down my forearm. I'm feeling some popping in my forearm right now. Feels pretty good. And I'll do this for just a couple minutes until I feel like my forearm is fairly loose. And then to get the back side of the forearm, you can put it up against something like that, and then do the same thing right in there as you're going. And you can use that same exact principle for doing the bicep. So if I want to use the bicep, I can just use this right in here, go up underneath, and then get my bicep just a little bit. Now I don't want to crush my bicep to the point where it hurts. Okay, this is just soft tissue work. Emphasis on the soft. This is not supposed to be deadly, okay? So now that I just did some soft tissue on my forearm and my bicep, I'm gonna go through some pronation and supination swings here with a bat. I'm gonna start out pretty slow, and my goal here is to just get myself into end range. Like right now, that's as far as I can go into pronation, which is fine. and then that's about as far as I can go with supination. I'm just gonna work this till I can get just a little bit farther. So I'm gonna go back and forth, and then hopefully I can get down just a little bit more. There you go. Now the bat's touching the floor. And notice this isn't because of my wrist bending, okay? Obviously, I can go more into pronation, or it looks like I can, if I compensate at my wrist and bend down here. That's not what I'm going for, okay? I just want to keep the elbow in a fixed position and go back and forth a handful of times until I start to feel like these tissues are getting really prepped, warmed up, ready to go. Again, no real sets and reps with all this stuff, but you want to keep it fairly light. You're not trying to kill yourself before you go throw. You're not trying to exhaust all your tissues before you go throw. You're just trying to prep yourself to get ready. Okay, so if you had some shoulder pain and you did the internal, external rotations, you did the soft tissue work, that may be all you need to prep yourself, feel like you're good to go, and then go throw. But for others who have a little bit of bicep pain, some forearm pain, things like that, you may need a little bit more. So now I'm gonna send some force to these tissues in here, and the easiest way to do that is to just grip something. So what we do here is we just hang both pronated and supinated grip, and only 1 or 2 sets of 20 seconds. Main reason being, I don't wanna hang to failure. I don't want to exhaust these tissues before I go throw. Okay, so pronated grip just looks like this, and I'll hang there for 20 seconds. Supinated grip, all I do is turn it around and I hang there for 20 seconds, and that's it. Now I've sent some force to these tissues, okay, and they should be all right. But if you need a little bit more, you're probably gonna start looking at the back now to start mitigating some of the pain for both the shoulder and the elbow. But now, for these banded T-spine rotations, I know everybody knows what a T-spine rotation is. If you don't, you're a little behind the curve, okay? But for these ones, again, I wanna pull myself into a deeper range of motion. So if I'm gonna do my right arm, I'll put this thing like this, put it behind my head like that, okay? You can tie this up to anything at the field as well. And then all I'm gonna do here is make sure my hips don't move, and I'm gonna rotate to the sky and let this band pull me into a deeper range of motion. I need a little bit more tension, so I'm gonna scoot out. And I'm gonna pull up, try to look at the sky, don't let my hips move, and then go right back down, okay? And I'll do maybe 2 to 3 sets of that, 3 to 5 reps for T-spine rotations, okay? And that'll help free up my upper back a lot. What a lot of people don't realize is that it's not just about how your scap moves around the rib cage, which we're gonna get into, but if you don't have access to T-spine rotation during your throw, so you don't have access to this stretch, then you're gonna try to compensate and stretch somewhere else, which then can lead to some arm pain. Now these are called Serratus jabs. Now when you're doing these, okay, the goal here is to press out and up and around. And when we do that, the bottom of the scapula, the bottom of that triangle is just gonna kind of make its way around the rib cage, okay? It's called a Serratus jab because you wanna activate the serratus right here in your armpit as it's coming up and around the rib cage. So I'll do the same thing here, 2 to 3 sets. 3 to 5 reps, up and around, nice under control. Where a lot of people go wrong with this though, is they'll dump their shoulder in the anterior tilt here, and they'll just hammer through it like that, okay? You wanna take your time. Keep that shoulder back, the humeral head in good congruency with the socket right there, and then press up, feel that scap come up and around and out. Press up and out, just like that, okay? On the descent, I wanna make sure that I control where that head is in place with the socket. I don't wanna let it fall forward like that. So here's the thing, by now you're watching this video and you're like, okay, that's a lot. Am I supposed to do all this before game? No, you pick and choose, okay? Pick and choose. We went over a little bit of soft tissue work. There's a lot more soft tissue stuff that you could do, but I went over that as if I was at the field, okay? Because most of you guys are gonna be doing this at the field. You don't have time to get into the weight room or get a PT to work on you right before the game and things like that. Okay, so I only went over some basics with the soft tissue, some basics for internal, external rotation, a little bit of force sending tissue here. Now we're getting into more of the corrective exercise that you can do whenever you like. But again, you're gonna pick and choose. So for this next one that we're gonna go into, it's gonna be wall slides. Now there's a lot of different variations of wall slides, but the main goal with the wall slide, I know I'm wearing this big loose baggy shirt so you can't see my scap, is that the scap comes up and around the rib cage when we're doing it. So we want to make sure we don't compensate at the rib cage and we don't go like this so that way we can reach further. We want to make sure that when we're up against the wall, we're keeping everything stacked. So I want to feel like my ribs are stacked right on top of my pelvis and I'm not moving there, I'm concrete. And for these ones, I'm going to show you what a wall Y slide looks like. So I'm going up the wall here, trying to keep my elbows intact. And as my elbows start to come off, I'm not going to extend at the rib cage or the lumbar right here. I'm going to keep going up, keep my ribs down. And then once I get here, now I feel like that's as far as I can go. My scap's up and around, and now I'm gonna come right back down, right in there. This is probably one of the most popular wall slides that people do nowadays. And if you feel like you're having a lot of trouble trying to keep your ribs down, just get a little bit closer to the wall so you know when you're starting to come back like that, okay? The next progression to that is gonna be with liftoff. And what that does is make the scap posteriorly tilt right here, okay? Which you're gonna need that tilt when you actually go through the throw. Okay, as you flip up and get back into external rotation, the scap has to have the ability to posteriorly tilt at the very bottom. Okay, so when you're going up here, you can do a Y wall slide, lift off, hold, come right back down, no compensations at the rib or lumbar, and come down. You can also just do a regular wall slide right out in front of you. I like to round my back when I do it, so I exaggerate my ribs staying down. And then when I lift off right in here, I can put my hands back here, add a little bit more difficulty to it, and then come right back and go like that, okay? If you're doing these right, there is gonna be a lot of tension right around your mid upper back. If you're just sitting here banging wall slides like this, which I see everybody doing, it is not really doing anything for your scap. It's not moving all the way up and around the rib cage. You're not getting a good posterior tilt there. Okay, so we have done some T-spine rotation stuff. Now we're gonna actually do some T-spine extension. And for those of you who don't know, you need access to a lot of T-spine extension during the throw. If you don't have access there, that means you're gonna try to create access somewhere else, which can lead to compensations later on. So what we're gonna do here is lie prone, just like this. These are called T-spine extension pales rails. My pales contraction is gonna be driving my elbows into the ground, okay? And as I'm doing that, I'm trying to create like an ab crunch, okay, that I physically can't. So my knees are gonna stay attached to the ground, my feet are gonna stay attached to the ground, and I'm gonna start driving my elbows into the floor here. I'm gonna do that at about a 7 out of 10 if I'm prepping to throw, but if this is a training session and I'm just trying to gain more T-spine rotation, I can go max effort on this, okay? So I'm gonna go down about 5 to 8 seconds. Now when I pick myself up, I wanna make sure that it's not coming from my neck, but it's coming from my upper back. So that's why my hands are wrapped around my head like this. All right, here we go. And there is a lot of cramping in my upper back right now. And as you can see, I don't have access to a lot of T-spine extension, okay? But as I keep going throughout this, I'm gonna gain a couple degrees every time that I do it. And that's the goal. There you go, that's just a little bit more. And the goal for that is try to hold it for about 5 to 8 seconds. Now, if you're a thrower, you want way more than what you just saw there. You want a lot of T-spine extension while being able to maintain your rib cage on the ground and not compensating up at the lumbar in order to get that. So there is a very big difference between passive range of motion and active range of motion. Passive range of motion is if somebody stretched me back into external rotation, right? Active range of motion is only what I actually can get there myself with. The difference between those two is where you can actually see an injury, because that means you can't apply force back there, okay? So for some of you, you may have a lot of passive range of motion when it comes to T-spine rotation, when it comes to shoulder horizontal abduction, when it comes to a number of things, internal rotation, external rotation, what have you. But what's more important is that it's active. That's why you consistently see a regular theme here in these videos. It's not about stretching. It's about sending force to those tissues and trying to gain active range of motion prior to throwing. Okay, so in this video that I'm going to show you here, this is more for horizontal abduction with your shoulder. So what we're going to do here is I'm going to take my arm like this and I'm going to go to what my active end range of motion is. Okay, so from this video, from this angle, it's going to look like that. I'm going to take that same thing and I'm going to get up on the wall here. Okay, so right now, this is all that I have access to. But what I'm going to do is put myself into an end range so I can do a lift off from end range. So I'm going to put myself into a further range of motion than what I can actually gain, okay? And I'm gonna get about right in here. Now you'll notice my shoulders are tilted, okay? Because I don't actually own this range of motion. I'm kind of stretching myself into it. But my goal here, because this is a very deep end range for me, this is beyond what I can access, is now I'm going to lift off by lifting my hand off of this wall. It's gonna be very difficult and there's probably gonna be some cramping involved. But I'm going to try to keep my torso and my body positioning in place. I'm not going to allow it to move, okay? So I'm going to use this wall as kind of like a kickstand for me so I don't fall into it as I lift off. Here we go. And now I'm only about an inch off this wall, okay? And I feel the whole backside of my shoulder lighting up. Now after I put it back on the wall, I'm gonna get a little deeper into that range. And it's a little bit easier for me to do that too. Before I couldn't really sink into it like this. So I'm a little bit closer to the wall. Now I'm gonna try to lift off one more time. Again, I'm about an inch maybe off the wall. I'm gonna hold that about 5 to 8 seconds. And then I'm gonna go back onto the wall right there and exaggerate a little bit deeper end range of motion, okay? Whew, the backside of my shoulder just lit up from that. All right, so now on that one, I'm sending force to the posterior side of my shoulder, all back here, trying to increase how much access I have to this. So that way when I go throughout the throw, I feel like I can get a lot back there. Okay, so if you lack that, that'd be a good drill to start doing, good exercise to start doing. Baseball players need access to a lot of overhead flexion, okay? If you don't know what you have access to, simply get up on a wall, put your tailbone on the wall, your whole spine on the wall, and your head, okay? So every last bit's on the wall, and I'm not gonna allow myself to compensate at my low back. I'm not gonna allow myself to take anything off the wall, and then I'm gonna take my arms, I'm gonna reach up overhead, and I'm gonna see how much overhead flexion I actually have access to. This is all I have. So as you can see, I can't get my forearm or my hand to the wall. I'm missing a decent amount of range of motion there, right? Passively, somebody could come push my arm to the wall and I'd be able to get more, but it's not about passive, it's about active. So now I'm gonna go through some overhead pails and rails to increase my overhead flexion, and then we'll get back on the wall and see if it improved. All right, so this is a little bit more difficult to do when you're by yourself, but I got some yoga blocks here set up so that way I could just pull from them and use them as I get going, okay? So the first thing I'm gonna do, start off right here, and I'm just gonna press my arms, my elbows, everything down into the ground as hard as I can for 5 to 8 seconds. And then I'm going to lift them up, and whatever I have access to right there, I'm then going to slide myself up here. I'm then going to put these underneath my arms so that way I can do that in a deeper range of motion again, okay? So here's what it looks like. So I'm gonna press down about 5 to 8 seconds, head stays down. And right now, my lats are really engaged because I'm pressing my whole arm into the ground. And then when I lift up, I'm not gonna compensate anywhere, and I'm just gonna pull as high as I can. And now using that, it looks like I almost got on top of the second block. So I'm gonna use both of these blocks. I'm gonna relax in this range of motion for a second. So after hanging out here for a few seconds, now I'm gonna press these arms down, drive into the ground as hard as I can, and then now I'm gonna lift up. And if I can get another yoga block in there, I will. Oh, I don't think I can. But that's okay. I'm gonna hang out right here again. Just sit in this range of motion. And then I'm gonna go one more time. Now I wanna make sure my elbows stay locked when I'm sitting here. I don't wanna let them sag down to the floor. I wanna keep them locked, keep my back somewhat engaged. All right, now I'm gonna press down again. Not compensating anywhere. Keeping my head down and lift up one more time. Okay, so now that I've done that, we're gonna get up on the wall and we're gonna see if I gained a little bit more range of motion. Tailbone's on the wall, whole back's on the wall, head's on the wall, and here we go. Yeah, I'd say that worked, okay? So here's the thing. It's not about me gaining that range of motion today and being like, okay, I'm good, I'm done, I've gained all that range of motion, I'm gonna have it tomorrow. No, it's gonna go away. Once I go to sleep at night, I'm not gonna have access to that range of motion. It has to be a continuous part of my training in order to make small incremental gains in my mobility so I can get into better positions during the throw. So these are gonna be some isometrics for your elbow, all right? So when I'm doing these, I'm gonna slowly increase the range of motion that I do these at until eventually I'm all the way at extension, and then it's no longer gonna be for my elbow or tricep, it'll actually start going into my lat, all right? So what I'm gonna do is find where these bands, I got 2 bands here, they're pretty tight, they're fairly new, so I'm gonna go about right here to where I can't really extend it any further, and then I'm gonna push into those bands and make sure that I maintain this space right here, this shape with my elbow. I'm gonna hold that for about 10 seconds. Right there, constantly pushing into the band. Then I'm gonna relax just a little bit, make that angle a little bit longer there, and now press right there. Same thing, 5 to 10 seconds. If you're doing this before a game, shorter is better. Okay, right there. I start to feel it light up right around my elbow, right on here, and right on this side. And then I'm gonna go back just a little bit. I'm almost all the way at extension, but not quite. I wanna make sure I can get down in here. So I'm gonna press down. Yep, and that's lighting it up right around in here now. I feel a lot in my tricep now, and you'll start to notice as you get going, you're gonna start recruiting more tissues all around your arm, which is normal. That's what happens with isometrics. You start recruiting roughly 15 degrees from the center spot that you're doing it at. Okay, right there. Now that I'm all the way at extension, I'm trying to pack my lat into my back pocket and pull my arm down as I do that. Ready? Right in there. These bands aren't really that strong. There we go. Now they're working. So now my whole lat's engaged, and I'm just holding it there. Now I'm going pretty hard right here, but again, if it's before game, I'm not going that hard, I'm not holding it that long, and then you relax. And sometimes that's all it takes, a little bit of isometric work, start sending force to these tissues, start recruiting all these tissues before I go throw, and I've known that that has helped a lot of guys start to immediately mitigate some of that lingering little pain, some of those clicks that they have during their throw. All right, so like I said at the beginning of the video, don't shotgun approach all this stuff that you just learned in this video. For a lot of you, a lot of these exercises you've seen before. You've seen all the corrective stuff all over social media. You've seen all the fear-mongering posts where people try to sell you an arm care program to take care of all your pain, okay? Most of you don't need that. Most of you are probably just weak, and you need to hire somebody and put them on so that way you can learn how to get stronger the right way and save yourself all the time and effort of trying to figure it out on your own. But I also know that only 1% of you will actually do that. That's why I'm creating content like this. So I hope that you can use this stuff and apply it to your game right now. Pick and choose based off the symptoms that you have and where you suck at, what you lack at, mobility-wise, and start targeting that stuff in your training. But here's the big thing. If you're not consistent with it, it's not gonna work anyways. You need to be consistent with it. What I recommend is choosing a handful of things that you're gonna start implementing before your games or before practices or on your training days, however you wanna organize it for yourself based off what you have. And then from there, implement it for about 3 to 4 weeks at length, and then rotate some of those exercises or progress some of those exercises in intensity. Okay, you should start to notice some benefits after about 4 weeks if you're being consistent with it. Consistency is at least 3 to 4 times a week while you're doing these things, okay? If you're only doing it once a week and then you rotate the exercises after 2 weeks, yeah, you're probably not gonna get any better because you lose all that range of motion you just gained and you're not gonna be able to be consistent enough to make significant progress. So keep that in mind when you're doing that. Please like, subscribe, share this video with your friends if they got lingering arm pain, and I'll keep posting content like this.